Dr. Hub. Today we look at the ATT regimens. So ATT regimens in case of the TB patients. So as per the recommendations of the NTEP, what is NTEP? It is a National Tuberculosis Elimination Program. So there is a treatment of TB is based on the drug susceptible testing. So it is based on the drug susceptible testing, and this is irrespective of new cases, previously treated cases, or the recurrent TB cases. So it is irrespective to that of the new cases, the previous treated, as well as the recurrent TB. So all cases of TB are treated with the drug sensitive TB regimen. So they are treated with the drug sensitive. This is a drug sensitive TB regimen, and as long as the patient is sensitive to the isoniazid and the rifampicin, isoniazid as well as the rifampicin. So there is no classification into the category 1 and 2. There is 1 and 2, there is no classification, So the type of TB case, there is a new or previously treated, and this will be the H and R sensitive. So in such cases, in case of the intensive phase, there is going to be 2 months. There's 2 months of the HRZD, and next there is something known as a continuation phase. The continuation phase is 4 months, and this will be of the HRE, 4 months of the HRE. So now let's classify based on the drug resistance. So based on the drug resistance, there is the MR. MR is a mono resistant. So in mono resistant, the TB patient who is resistant to one first line anti-TB drug only is basically a TB patient is resistant to one first line drug, first line anti-TB drug. Next is the PDR. What is meant by PDR? PDR means the polydrug resistant. Polydrug resistant. So this is basically a TB patient who is resistant to more than one first line. So patient is TB patient. It is resistant to more than first line anti-TB, first line anti-TB, greater than first line anti-TB drug other than the rifampicin and isoniazid. So this is other than the rifampicin or the isoniazid. Next we look at the RR. RR means the rifampicin resistant. So this is basically a TB patient who is resistant to the rifampicin, and this is with or without resistance to other drugs. So this can be with or without resistance to the other drugs. And the patient who have rifampicin resistance, so the patients who have the rifampicin resistant, they should be managed as if they are the MDR case. So they should be managed like the MDR TB case. Management should be done. Next, let's look at the MDR. So what is exactly meant by the MDR? MDR means a multi-drug resistant. So here it's a TB patient who is resistant to both. So it's resistant to both isoniazid as well as the rifampicin. Then comes the extensive drug resistance. So this is a MDR TB patient, and who is additionally resistant to, so the patient is additionally resistant to the fluoroquinolone, that is the ofloxacin, then levofloxacin as well as the moxifloxacin, and at least one additional group A drug. and one additional group A drug. So this is as of 2021. These are include the bedaquiline as well as the linezolid. So now let's have a look at the standard DR, that is a drug resistant TB regimen. So this is important. Looking at the standard DR TB regimen. So what do we have here? First class is the H mono. This is a resistant. Then there is a poly drug resistant TB regimen. So here the drugs include LFX, RE as well as Z, and this will take place for 6 months. And this is 6 months long, and they are all oral drugs. Next we move on to the shorter. So we move on to the shorter oral, the bedaquiline regimen. So it is nothing but the shorter MDR. So here there is the intensive phase. Intensive phase, it includes the LFX, BDQ, and this will be for 6 months. Next it also includes the CFZ, Z, then E and ETO, and this is for the 4 to 6 months. Next is we look at the continuation phase. So in continuation phase, what do we have? We have LFX, CFZ, Z and E. So this is taken for 5 months. So what we need to know is, in case of the intensive phase, it is about 9 to 11 months long totally. So these are 9 to 11 months long totally, and the injectables are used in case of the intensive phase. So injectables in the intensive phase. Next is we look at the longer MDR TB regimen. So in terms of longer MDR TB regimen, this is nothing but the BDQ. This is 6 months or longer. And what do they include? They include the LFX, the LZD, the CFZ and the CS. So here there is 18 to 20 months long, and there are only oral drugs. So this regimen is used for, they are used for the XDR TB patients, and this is done for 20 months. Next is we will look at the criteria for the patients. So before that, let's look at the short forms we used. FQ we used was for the fluoroquinolone, and then comes the SLI. It means the second line injectables. Next we use commonly LFX. This is the levofloxacin. Then H is for the isoniazid. Then HH is for the high dose isoniazid. Next comes R. R is for rifampicin. E is for ethambutol. This is rifampicin. Then E for ethambutol. Next comes Z. Z is for the pyrazinamide. Then comes MFX. MFX is nothing but the moxifloxacin. Then KM we used was for the kanamycin. AM is for the amikacin. Then ETO we used was for the ethionamide. Then there is CFZ. CFZ is for the clofazimine. Then there is also the BDQ we use is for the bedaquiline. Then the LZD, this is for the linezolid. Then comes CS for the cycloserine. Now let us go back to the criteria for patients. So we are left out with the criteria for the patients. This is to receive a standard drug resistant TB regimen. So what happens here is, in case of the H mono resistant or the poly drug resistant TB regimen. So in this case, what is the inclusion criteria? So this includes the isoniazid TB, and this is along with the rifampicin sensitive. So there is no exclusion criteria here. Then we look at the short MDR TB regimen. So in this case, there are inclusion criteria. There are patients, and this is with the rifampicin resistant. Patient with the rifampicin resistant, and they include the pulmonary or the extrapulmonary TB. Pulmonary or the extrapulmonary TB. So what are the exclusion criteria here? The exclusion criteria, it includes, there's a non-drug sensitive test. So there's a non-drug sensitive test based criteria. So what does it include? This includes the pregnancy as well as any extra pulmonary disease. So includes any extra pulmonary disease. This is in case of the PLHIV. Then also the disseminated meningeal or the CNS system TB. So disseminated meningeal or the CNS TB. Next, it also includes the intolerance to any drug. So also the intolerance to any drug. This is in case of the shorter MDR TB regimen. Next is the other exclusion criteria. It includes the drug sensitive test based criteria. So what does this include? So this includes in case of if DST or DRT result for the FQ, results for the fluoroquinolone or the SLI, so is resistant. That is the XDR TB. Then there is in case of presence of INHA mutation, also in case of the resistant to the Z. Next we move on to the longer MDR TB regimen. So in terms of the longer MDR TB regimen, this is in the inclusion criteria is the patients in shorter MDR TB regimen, and it cannot be considered due to any reason, and cannot be considered due to any reason, and it doesn't have any exclusion criteria. So this was all about the ATT regimen for the TB patients. To learn and grow daily like this, please do subscribe.